Have you ever wondered why some people, like my guests and I, have so much faith in the healing benefits of low carb? If that's you, this video was made for you. Hi, I'm Dr. Hampton, and I'm on a mission to help you achieve metabolic health. And today I have a guest and a friend, Dennis Pollock, who's here. And he's going to be on my Protecting Your Nest podcast as well. But I wanted to bring him to this video to share his thoughts on why is it that we have so much faith in low carb? So I want to hear his perspective first, and then I will share mine as well. So Dennis, tell my audience why you like low carb so much.
Well, I basically see it as saving my life, or at least saving my sanity. I was going through some terrible blood sugar swings. I had what is known as reactive hypoglycemia. It was bouncing way too high and then dropping way too low. And I heard from somebody that you should just eat a all plant diet and no meat at all, and that made it 10 times worse. And so finally, I read a book by Dr. Bernstein and a couple of others, and they were saying go low carb. And I'm like, well, that's just the opposite of what I heard before. They can't both be right, can they? But anyway, I tried that, and boom, all my blood sugar problems disappeared. It stabilized. And then later, I got even more serious about it. And the lower carb I went, the better my numbers were, the healthier I felt, the more stable my glucose was. So number one is me. I've tested it on myself and I found it works. And then number two, after a while, I thought, well, I'll start a YouTube channel and kind of share my story and see if it can help others. And I tell you what, Dr. Tony, we've had so many, I dare to say thousands of people that have said and testified, this works for me too. So apparently it's not just Dennis, it works for a lot of people.
I love it. And I agree that your YouTube channel has definitely resonated with your audience and certainly me as well. And so beat diabetes for all those who are checking out this video, check out that YouTube channel. For me, it's interesting. Low carb has changed my life. I actually go to work as a clinician, happy to go to work. And that's because so many of my patients are starting to heal and reverse many of the chronic diseases that they once thought were not reversible. So that's number one. Number two is it's not just my clinical experience, it's the clinical experience of others that I respect and follow, like Dr. Tro, Dr. Brian Linskis, those guys are with the low carb MDs, Dr. Eric Westman and others. So I see that they're being successful as well. And even the testimonials of patients who, or people who follow me on YouTube, you hear the testimonials of all the success they're having. But even more so, I've looked at the research, and so many of my patients who had type 2 diabetes also had issues around their weight. So one of the things that I love about the Public Health Collaborative is that they've actually put together all the trials of low carb versus low fat. And what they found is that for significant weight loss, it's 36-0. In other words, there's no low fat studies that are randomized controlled trials that were better for substantial weight loss compared to low carb. So knowing that exists as well was very helpful. And although I wrote my Fix Your Diet, Fix Your Diabetes book, way before the larger organizations started to endorse low carb, it's nice to know that at the end of 2019, that the American Diabetes added low carb and very low carb, which is keto, to one of their dietary patterns. So it's nice to know that we have large organizations supporting that. It's also nice to know that March of 2022, the American Heart Association put out a position statement about which dietary patterns that they recommended. One of which was the low carb diet. And what was really interesting about that statement, which was very, kind of funny to me, but in a good way, is that they said that, very low carb diets were effective at reducing hemoglobin A1Cs over shorter time periods with less differences in intervention. So they were so impressed by the keto diet that they actually suggested that medical professionals follow those patients closely because it's that effective. So it's nice to know that the diet works that well. And then even before those two organizations, the American College of Clinical Endocrinology listed low carb as one of their dietary options. So I think this is important because if you have clinicians who are not aware of this information, you can share that with them so that they can also have faith in low carb. Finally, I'll talk about a couple of people I love and respect. Dr. Eric Westman, who has been doing research on low carb, for years. Wanted to study the effect of a low carb diet, ketogenic diet versus low glycemic diet. He shared in that study, which was done, I think in 2008. He shared the success of how effective that diet was as well. And another clinician I respect is Dr. David Unwin and his wife, Jen Unwin, who also have a low carb clinical practice. And in that clinical practice, they've shown that the low carb approach is very effective at not only reducing, the risk for diabetes and prediabetes, but it's actually sustainable. And a lot of people think that these dietary patterns are not sustainable, which is really not true. And I think me and my guests both agree. It's not that hard to do low carb. So I want to bring this video to you guys just to remind you that we have faith in low carb because it works, it's evidence-based, and we see the results each and every day. So if you want to hear more from my guest, Dennis, in this video, we did a podcast together for the Protecting Your Nest podcast. I'll be sure to have a link in the show notes, as well as a link to his wonderful YouTube channel, Beat Diabetes. So if you have somebody in your life who's trying to beat diabetes, Dennis's YouTube channel is probably what you should refer them to. So having said that, I really appreciate you coming to this video. And until the next one, continue to be safe, be well, and continue to protect your nest.